So in this section, we're going to have a look at how to deal with a baby who is choking. Choking is a blockage in the airway, and the airway is the main route for air, particularly oxygen, to get into the body and for air to get back out. So we need to do something about it. We need to clear it as a matter of priority. In terms of knowing whether baby is choked, we're looking for signs and symptoms like baby is awake, moving, eyes are open, but they're not able to make any noise. You may also get a blue tinge around the face and particularly around the lips. To clear the blockage, we're going to pick baby up, supporting the head. And as we pick baby up, we're going to make sure that the head is facing down in comparison to the body. Babies are much more likely to choke on a liquid. So in this position, it allows it to drain away. Next, we're going to use the flat of our hand right against the centre of the back between the shoulder blades, and we're going to deliver up to 5 back blows. I say up to 5 because you may be able to clear it with just 3, in which case there's no need to do the other 2. Using the flat of your hand, you're going to deliver the blows like this. And if that doesn't work, we need to do something more. So we're going to put baby back on a flat surface, like our knees or onto the floor. We're going to use 2 fingers in the centre of the chest, and we're going to deliver up to 5 chest thrusts, nice and sharp, a little bit like this. If that doesn't work, we need to pick baby back up, do 5 more back blows, back onto the ground, 5 more chest thrusts, and continue that cycle until help arrives. If you're absolutely on your own, you can take baby with you to the phone to make the call to the emergency services, and you can carry on the treatment while that call's in progress.
It was the first time we were giving Dexter his vitamin D drops. He was very young, a couple weeks, and we were starting to feel really confident. My husband and I were getting this baby thing down, and I guess we just shot it right in his mouth instead of doing it slowly, bit by bit, and letting him try and suck. We just shot it right back, and he sort of sputtered and choked a little bit, and then fell asleep. I mean, he was a newborn, and so he was always sleeping, but it just seemed to be a reaction to him taking this. So we were worried. We choked him or aspirated him. We called a telephone line with nurses, and they asked us a bunch of questions, and in the end they said you best be safe, and recommended that we go into emergency. So we took him in the middle of the night, and he ended up being fine. We spent a couple hours there. We talked to a doctor. They looked at everything, and it was fine, but and sent us home on our way with we didn't need anything, but it was a scary experience.
So you're going to pick baby up, supporting the weight of the head underneath the chin. That's it, good. Flat hand right between the shoulder blades, sharp blows. Good. Good. Pop back down on a flat surface. 2 fingers right in the centre of the chest and a short jabbing motion. That's it. Lovely. Well done.
Why is it when a child is a baby or a toddler is choking, you don't give them water, but you would as an adult if you're choking, you drink some water?
Well, you have 2 pipes that go down your throat. One of them takes the air to the lungs and the other one takes food to the stomach. If you give somebody a glass of water, then the water will be going down the pipe to the stomach, whereas with choking, the blockage is in the airway, so that won't actually help.
If the baby's choking, why can't you put the finger down and try and get whatever's in there out, or try and dislodge it?
In a choking, the blockage is quite far down the airway, so it's sort of down in the throat area. If you put your fingers into the mouth, there is a chance that you could make the choke worse. You could push the object further down. The other problem is with babies, because they have very small mouths and our fingers are quite large, you can actually do quite a lot of damage to the mucous membranes on the inside of the mouth.
Okay.
So you're going to pick baby up, supporting the weight of the head underneath the chin. That's it. You want the head facing slightly down. Using the flat of your hand, do 5 sharp back blows. Good. Checking between each one. Well done. Pop baby back onto flat surface. 2 fingers right in the centre of the chest. 5 jabbing chest thrusts. Very good.
If your baby then becomes unconscious, do you then move to CPR?
If baby is choking and has become unconscious, then yes, you do need to do CPR. If they have a blockage to the airway, it could be that the breaths that we're putting in actually push the object further down, because your airway branches into 2, so you can push it down one side and you'll be able to get air into the other side, keep that oxygen going, keep the brain alive, and hopefully save the baby's life.